Hello and welcome to this educational video about shoulder and elbow crutches. First, we will look for definition of crutches. Crutches are medical devices designed to aid in ambulation by transferring body weight from the legs to the torso and arms. There are three types of crutches, which are axillary, forearm and platform. But in this video, we will cover only for axillary, or also called shoulder crutches, and forearm, which also called as elbow crutches. The doctor will recommend crutches for you only if you have good balance, strength and endurance. Now, let's look for difference between both crutches, which are shoulder crutches and elbow crutches. Shoulder crutches are the most common type. These crutches are best for short-term use. The design is intended to transfer most of the user's body weight to the arms and torso. Shoulder crutches are not ideal for people with wrist problem, weak upper body strength, or impairment of coordination, while elbow crutches are better for long-term use. The weight of the user is transferred mainly to their entire upper arms. The user needs good upper body strength to use these crutches properly. Indication for crutches is any temporary or permanent condition where compromise of lower extremity balance and weight bearing exists with a patient who has sufficient upper body strength and coordination to support and move their own body weight. While contraindication for crutches is the very old and very young may not possess the need to torso strength and coordination to use crutches successfully, and any muscular or neurological condition that reduce the mobility, strength and sensation. Crutches also may be indicated if a patient has lost the use of a limb, it is either injured or amputated. Purpose of crutches are include to help in balancing the body by spreading weight over a wider area, to keep someone safe when there is a loss of feeling in the leg, to decrease weight bearing on involved joints, and to give support when muscles are weak. Before using the crutches, we need to adjust the height of crutches suit with our body height. For safety tips, make sure the padding at the top of crutches is in a good condition. Make sure there should be 2 until 3 fingers space between the crutches and underarm. Meanwhile, the bottom end of the crutches should be more than shoulder width apart. The handle should be placed at the level of wrist when the arm is straight down by our side. The elbow should be slightly bent. First, put all of body weight on the uninjured leg. Then, move both crutches forward and about 12 inches. Shift the body weight onto the crutches. Next, strengthen the elbows. Lift the uninjured leg and swing the body up to the crutches and repeat the cycle. Firstly, move both crutches and the injured leg forward about 12 inches. Shift most of body weight onto the crutches with just a little weight on the injured leg. Bring the opposite leg forward and repeat the cycle. Stand with body weight equally on both legs and both crutches. Next, move the left crutch forward followed with right leg. Then, move the right crutch forward and follow with left leg. And repeat the cycle of left crutch, right leg, right crutch and left leg. Get close enough so the back of the legs is touching the chair. Place both crutches in the hand on the side of injured leg. Place the other arm on the armrest or side of the chair and lower the body into the chair. Place both crutches on the floor and sit comfortably. Slide the body to the front of the chair and place both crutches in hand side to the injured leg. Push yourself using the hand grips and the chair armrest. Once standing and balanced, arrange the crutches under each arm.
Going up the stairs, start close to the bottom step. Keep your injured leg off the ground. Keep the crutches under both arms. Put your weight through your hands and hop with a good leg onto the first step. Then move the crutches to the same step and gain your balance. Repeat this, always leading with a good leg going up the stairs. When going downstairs, start close to the top step and keep both crutches under both arms. Place the crutches on the middle of the step below, put your weight through your hands and bend your good knee. Step down with your good leg. Gain your balance and repeat, always leading with the crutches.
Firstly, adjust the height of the crutches. Adjusting the shaft of crutches so that the hand grip becomes even with the wrist while standing. Adjust forearm cuff. You should have about 3 fingers width from the top of piece and elbow. Make sure the crutches are about 10 cm away from the feet. Place both crutches on a step forward. Then move body forward between the crutches, supporting the body weight through the hands and good leg to bring the body level with the crutches once again. Bring the crutches about a step forward, then bring the injured leg up to be same level with the crutches. Next, swing through the good leg and repeat the cycle. Make sure that the leg touch the chair. Remove the arms from the cuff before sitting. Put both crutches together to make H shape to support. Bring the injured leg out and slowly lower the body onto the seat. Put both crutches on the floor and sit comfortably. Slide the body forward to the front of the chair and take the crutches. Place one hand on both crutches handles and other hand on the armrest of the chair. Push the body up to stand, and once standing, hand can be placed inside the cuff.
Steps can be done with all weight-bearing statuses. While descending, put the bad foot and crutches down first, followed by the good foot. While ascending, put the good foot up first, followed by the bad foot and crutches. Remember, the good go up first and the bad go down first, and the crutches always stay with the bad foot.
For evidence base, according to Maguire et al. 2016, canes and crutches enable partial and non-weight bearing gait thus unloading joints and potentially reducing pain when walking. According to Sanders 2011, axillary crutches allow for some relaxation of the pectoral, abdominal, diaphragmatic, and laryngeal muscle, and reduction of the internal and external distractional force. According to Springhouse 2000, crutches remove weight from one or both legs, enabling the patient to support himself with his hands and arms. These functions allow crutches to be used to accommodate lower limb weakness or abnormal motor control and to improve balance. As conclusion, crutches are one of medical devices that aid disabled people for ambulation. Crutches are mainly intended to give support for disabled people when walking. There are 3 types of crutches, and they have their own purpose and indication. The crutches user should adjust the height of their crutches before using it. The users also need to apply proper positioning to avoid and prevent unwanted incidents. Thank you for watching.